implies that one of the parties in a situation of vulnerability. Trust is essential between two parties to open up and to disclose sensitive information for better interaction, for better cooperation, leading to better care, better patient engagement, and adherence to its therapy. The notion of trust was already present in the Hippocratic Oath 2,000 years ago, but it mainly concerned the patient to practitioner. Now we have a very elaborated healthcare ecosystem with international and national public health institutions, medical authorities, regulatory bodies, ethical committees, assessment bodies, reimbursement bodies, private partners, etc. Healthcare is now one of the most regulated industries with a myriad of laws, guidances, standards, conventions, recommendations, etc. to ensure the security, the safety, the quality, the efficiency of healthcare. So with such an elaborated healthcare system, why are we still struggling with the idea of trust? Well, first of all, we have to deal with uncertainty. And of course, everybody has in mind what happened with the COVID, which put our healthcare system at shock. This breakout was associated with shortage of basic supplies, the masks, shortage of space in the hospital, poor specific medication. And to control the pandemic, basically, governments in most countries have put some measures, some recommendations, but these authorities need the trust of the people to make them efficient. So basically, we need pre-established trust to make us more resilient to pandemics. We need continuous trust maintenance rather than trust building to face uncertainty. We have to deal with confusion too. During the COVID-19 outbreak, look at how the media was overwhelmed with contradictory information, including fake news. There was so much information that the WHO warned about an infodemic during the pandemic to describe this overabundance of information. There was a study from the UK Ofcom saying that 46% of the UK and US population was exposed to fake news. And 1/3 of them said repeatedly, which is quite dramatic because we know that repeated exposure to fake news is more likely to make you adhere to it. Hence, we also need to fight against trust erosion in our system to face mis or disinformation. Another thing, there's a factor of trust erosion with criminality, of course. The advancement of digitalization in healthcare comes with a lot of opportunities, remote care, more efficient prevention, personalized care. But digitalization also comes with major challenges like cyber security. The number of cyber attacks in Switzerland had a 65% increase between the COVID periods, 2020, 2021. And guess which industry was the most attacked? The healthcare industry. It basically doubled during that period. So we're very prone, and our system can be destabilized by criminality. So, and now another question, perhaps not directly related to the COVID, but is healthcare ready for disruption? Just to mention, in 2018, Amazon, Berkshire Hathaway, and JP Morgan Chase have created Haven, which goal is to disrupt healthcare with AI to provide low-cost health and quality healthcare. 1 year later, Amazon launches Amazon Care to bring the most patient-centric healthcare. Haven has shut down in 2021, and Amazon Care shut down August this year. August this year, that same month, Amazon acquires One Medical for $4 billion to make healthcare experience more accessible, affordable, and even enjoyable for patients. So we see that Amazon is intensively pivoting to find the right way to tackle healthcare. If this big guy doesn't manage to disrupt healthcare, basically, is there any chance for the smaller players? So, as a conclusion for my introduction, I just want to draw your attention on the ambivalence of healthcare. It's at the same time very fragile because of its fragmented nature. prone to be dislocated by uncertainty, confusion, security breaches, and it's at the same time very solid, difficult to disrupt, and definitely trust is the cement of that system. Introduction of deep tech innovation adds a new class of stakeholders in the mesh of trust. AI, machine learning, big data generates complexities and thus fragilities that can potentially destabilize the entire trust network. I am convinced, that the transfer of trust, from the different stakeholders onto the technology is one of the major success factors to bring innovation in healthcare. I wish you an inspiring and fun event with all our speakers, and I have the pleasure to invite Arnaud Bernaert, Head of Health Security Solutions at SICPA, for a keynote speech. Arnaud, the floor is yours.
Thank you. And we're going to put my presentation on. So today I would like to discuss what we can learn from this pandemic period and what we can learn also about how trust building can be repaired between citizens and the policymakers. I'm myself Arnaud Bernaert. I joined SICPA 1 year ago from the World Economic Forum, where I was leading the health and healthcare practice for the forum. A lot of focus on pandemics since the Ebola crisis, including with the launch of the Coalition for Epidemics Preparedness Innovation in 2017 in Davos. This coalition was the first investor into technology solutions of the mRNA class, including being first investors in BioNTech, Moderna, and Novavax. The topic of today is really about making a little bit of a deep dive into those types of interventions that have proven successful in restoring trust. Before we go there, I would like to show my I'm conducting this thing. Okay. A little bit about SICPA. You know, SICPA is a well-established Lausanne-based company since 1927, providing services to governments in more than 180 countries, 3,000 employees, over 5,000 patents. And the traditional businesses of SICPA have obviously been to protect financial instruments, banknotes, with special security inks, which progressively evolved into the business of marking products for excise tax collection purposes, and then moved on into the health security solution business, including as we protect every year more than 1 billion pharmaceutical products against counterfeit medicine and falsified drugs. Recently, our chairman, Mr. Arnaud, decided to expand that business into providing solutions to governments to be better prepared to epidemics, and this is what we're going to cover today with some examples. Now, I'm not going to comment on all those words on this very busy paragraph, but what's important to note is this was the introduction of a report that was delivered in September 2019 by the Global Preparedness Monitoring Board that was set up by the Global Fund, the World Bank, and the WHO. What you can see in there is we need to invest in developing innovative vaccines, surge manufacturing capacity, antivirals, non-pharmaceutical interventions. We need to exchange data, share genomes, to actually anticipate better what could be the next event. And it explicitly talks about a rapid spreading pandemic due to lethal respiratory pathogens. Everything was known before. Everything was known before. And what we got in return is that mess. A patchwork of interventions that was totally unstructured, that was totally artificial in terms of the use of data. And this was from containment, confinement, school closing, home office, you name it. The problem is that when COVID-19 has impacted all countries worldwide, it has done that in very distinct fashion. And it is very often difficult for governments to foresee health threats and to know exactly what to do at what moment in time, to also keep in mind that they need to protect their healthcare systems against saturation. And they need to anticipate also on the resources they need to mobilize. PPEs, ventilators, you name them. The lack of precise information is what's causing that chaos. Because absent of good information, governments tend to implement excessive measures, and they can't explain those measures to their citizens' population, which is obviously affecting the trust and fueling conspiracy theories. In response of that, we need to provide governments and policy makers the correct tools to anticipate. And I will name just 3 of them in the next slides. Those tools should enable them to better resource planning. They need to help them make conscious decisions, risk-adjusted. And take an example amongst others, tailoring border entry protocol based on the precise risk of pathogen importation, as opposed to closing everything, which causes that catastrophe from an economic standpoint. So, in summary, governments need a decision-making cockpit. This epidemiology cockpit can be fueled by a number of data sources. There are actually zillions of them. At SICPA, we have been focusing on the blue ones on the left, testing wastewater in community and in aircraft. But there are also many other different things that can be analyzed. An example I like quite a bit is that the price of garlic being an indicator of a pathogen spreading for the reason it is believed to be a catalyst of immunity in Asian countries. So the price of garlic was actually increasing by a 10-fold factor in China in the early part of the crisis. And you could not get garlic in Indonesia as a result. So non-traditional data linked to social behaviors and cultural angles need to also be understood. But I'm going to start with wastewater. Wastewater has been proving to be essential in the monitoring of the epidemics very early in the crisis. Do you know that we were testing wastewater in 1854 in London, and that was John Snow, the father of epidemiology,